Well, thank you guys so much. So you probably know what's coming right now, if you remember anything from last year. So first of all, I have started my stopwatch because I am a CPA, and so I don't want to carry on too long and cause you to go to sleep through your great lunch. But Megan, the dictator, has said that I cannot start my presentation until I get someone to buy the free market version of the Yeti, a real t-shirt, a lightsaber for their grandchild or obsessed son that still lives in their basement but loves Star Wars, or this mini version of the Yeti tube. So I've got to have someone raise their hand. Oh, yep, he wants me to shut up right now. So which do you want? You're taking the t-shirt. Okay, so I've got the t-shirt gone. So there's other t-shirts. You should get one. Who's going to take this fancy free market Yeti from me? All right, right there. You're gonna buy it. I've got to set them right here. The lightsaber. Grandchild, son that just won't leave the house or the basement that plays video games. Somebody that they're $5. Oh yeah, okay, I see it. That's gone right there. You remember? And then finally, the cool. Yep, thank you very much. Let's thank those who took one for the team for all of us. So you guys have had an incredible time today, and so I'm going to start with a story that might surprise you in how it relates to the free market principles that you've talked about. As you know, throughout history, there have been people who have, at strategic points in history, stood up and made decisions that challenge the status quo. Many of you know the story of a young person who grew up in slavery, went in and out of slavery several times, and became very disheartened at how her family members were treated or people that looked like her. And so over the course of time, this person decided that they were going to do something about it, and that they were going to begin to work to help other people exercise the freedom that they deserved. You'll immediately know this person's name once I mention it, but this person was contrary to what someone more left-leaning might think. They were a gun-toting, gun-slinging slave rescuer, and her name was Harriet Tubman. Did you know that at the time when Harriet Tubman was helping with the Underground Railroad, it would have been very unpopular to be in a very, very public place saying that you felt like all men were created equal and that people should be smuggled or carried, if you will, to freedom. I view what you guys are doing much the same way. If you think about a couple of things right now, there's some pretty powerful statistics that are going on that the public should already be on your side if they're not. So it depends on what time you look at the year, but did you know that of the bankruptcies, 60% of bankruptcies in the U.S. at a minimum are medical bankruptcies? Here's the astonishing fact about those bankruptcies, though. 77% of those are to people that had major medical health insurance. So this whole notion from the president that I like the president as an individual, like what he's doing on the issue of corrections reform. I disagree with him on healthcare reform. But this whole issue that people just need to be covered and they're going to get care, it's false. I'll give you an example, a real-world example of what government healthcare growth does. We put out a report this year. It's called Out of Balance. I'd encourage you to check it out at www.ocpathink.org. So why did we put out this report called Out of Balance? As you can imagine, just like in some of the states that you're from, you are hearing that the Medicaid expansion is God's gift to the poor. You've heard a version of that, haven't you? And that if your state would just pass Medicaid expansion, sea levels would lower, the temperature and the climate would become moderate and go back to the way it was supposed to be. There would be no more problems. There would be no more homeless. It would be nirvana. And Jesus could go ahead and return because everything would be okay in your state. Well, that same message has been brought to Oklahoma every year, time after time. If Oklahoma would just get its act together and quit listening to OCPA and all those people that just say no, we would be better off. Some pretty astonishing statistics. The state share portion, so that's what the state of Oklahoma taxpayers pay for our Medicaid program in 1996, so we're just talking 2 decades ago, was $317 million. The state share portion for Oklahoma in 2016, 20 years later, 2016, 20 fiscal years later, is $2 billion. We've seen 556% growth in our state share of the Medicaid budget. While our Medicaid enrollment has grown 124% over that same period, our school enrollment has only grown 11%. If you look at the total growth in the budget of the Medicaid program in Oklahoma, it has grown from right about $2 billion to over $5.4 billion. So we've had 20 years now of trying this experiment where we just fork over more dollars to our state's Medicaid system. Outcomes are not any better for patients. We're finding that patients are not making better decisions. In fact, year in and year out, up to 50% of the births in Medicaid in Oklahoma are actually to mothers who had previous births on Medicaid. That would be because, as the Medicaid agency revealed to us, they're not really messaging to people that participate in Medicaid about healthy behavior and about how, what actually causes pregnancies, and then, how you prevent that since the taxpayer is paying for it. So even though we added, this is kind of funny, even though we added in Oklahoma the Family Planning Services waiver, so you guys are thinking, well, that's a good idea, right? No, it didn't really work out that way. What people found out is that they could get the state to pay for their vasectomies and everything else, but they still didn't use it. And at this point right now in Oklahoma, we cover 65% of births. Well, why do we cover 65% of births in Medicaid? Well, as the lovely doctor from Poto said, Medicaid births represent 90% of the revenue of my obstetrics division at our hospital. 90%. So do you think the hospitals in Oklahoma have any incentive to try to help patients make better decisions? The answer is no. But here's the problem. After what I just said, if you talk to the media or most people, they would describe me as someone who's lost my mind, an Uncle Tom, someone who's forgotten where I've come from. I've literally been called all of those things. Someone that's privileged. And so our problem that we face is that free stuff looks a lot better than the truth. It just does. Right now, I'm in a room full of people who love the free market, who love the truth, and are hoping to expand opportunity to people. But here's the problem. Once you go out in the world, yeah, there are some millennials that kind of identify with us and they kind of rage against the machine. But for the most part, we all sound like hardcore, white, rich people who don't care. So I'm going to try to do my best to be offensive like Jeff was, but only to people outside the room. And I'm going to be offensive to some of us in the room. But one of the questions that we've been asking at OCPA is, do we really care enough about the most vulnerable to speak in a way that they'll hear about it? So I'll give you an example. Last year, after the hospitals had killed our efforts to bring the benefits of bundled pricing and transparency to state employees, they killed it in the 2014 session, and they were very happy. Sorry to any hospital execs that are in the room right now, but I know who you are. And we began to think about, so why is it that we lost this battle? Well, quite frankly, we lost this battle because we talked about saving state taxpayer money. And right now, the majority of Oklahomans and Americans could care less about the taxpayer. Because again, the taxpayer is a white male who has absconded off with all the money in the economy from everyone else and lords it over everyone else. That's the perception that the media wants you to have, and that's a lot of what's sold. So we tried something different. We began talking about teachers. Teachers who hadn't had a pay raise in 6 or 7 years and were faced with the high deductibles on Health Choice's plan. Health Choice is the self-insured plan. It will not surprise you to note, but Health Choice's claim to fame was that they made some of the highest reimbursement rates to hospitals and medical providers. You can imagine how cool it would be if you're in the medical industry to get the state's self-insured system to pay you at a rate that no one else does. How do you do that? You get lobbyists that show up at the Capitol, and they prevail upon the governor's office, and they prevail upon the Health Choice office, and then they sell the story about this is how we create great access to care. So after you do that for about 10 or 15 years, the state's health insurance program grows by more than 150% over a 10-year period. Well, we began to tell the story of state employees who were going to get surgeries at these fine metropolises that build off of the prime real estate. If you have a chance today, I know many of you have to leave town, but we're like most cities where you've got, the inner city, and then you've got urban areas, and then you've got suburban areas. I am sure you find this the same. For some reason, the broke nonprofit hospitals always have the cash to buy the real estate along the brand new turnpikes in suburban areas that nobody else can afford. In fact, they participate in building arms races. They will buy prime real estate right along I-35, right across from each other, and build what looks like versions of the Taj Mahal with terraced stone and green shade grass. I'm a little bit ADD for a moment. This is part of what makes me really mad at hospitals. Have you ever tried to grow shade grass in Oklahoma heat? There's only one way to do it, and that is to provide more water to that shade grass than Noah's flood did to the earth. And so I encourage you to drive by MacArthur and the Turnpike. There's this beautiful mound of shade grass that I have to watch when I drive to work every morning that's just next to Integris ProCure Center. This thing is beautiful. It looks like a scene out of a James Bond 007 movie. And so these are the broke people. And this is why these lower class or middle class blue-collar workers in the state have to pay high deductibles through the state program, and then the state shells out significant amounts of money. Well, we began to look at what was going on at Oklahoma County, and many of you know the work of the Surgery Center. And we said, what if we start talking about how much we're going to save a teacher who hasn't had a raise? And what if we start talking about how much we're going to save a DHS social worker who hasn't had a raise? There's a saying from a guy, his name is Kevin Carr, and that is, facts tell, but stories sell. And I want to encourage all of us today to begin to think about how we speak to the most vulnerable, because our room is the one that represents the interests of the most vulnerable today. It's not the hospital. It's not the large doctor group that's in cahoots with the hospital that funnels all their patients to a hospital that's going to overcharge them. It's you that are in this room. And so there's a couple of things that I just want to share with you that we have to think about, and this is difficult, so I'm speaking to myself. For a moment, my background, I was an accountant. My parents were a hardcore grammar teacher and an engineer. We were probably the only black conservatives in Oklahoma in the early 80s. Literally, we left black churches because they were, we were essentially spending too much time talking about how to grow government. I mean, that's how radical my parents were. So as you can imagine, my entire life was like, the truth will set you free, and if you starve to death, it's because you're lazy, and it's what you deserve. That message does not sell anymore in the United States of America, as you can imagine. And so one of the things that we're beginning to learn at OCPA is that, first of all, if I am not telling someone that I care for someone, when you're sharing about the work that you're doing, if you're not first talking about the most vulnerable and who you care for, the rest of America is going to shut you out. Now, yes, we can go down the road about the fact that it's unfair, that they think that way, and that society has them that way, but it doesn't matter. We're in an emergency situation, both in Oklahoma and in the United States. And so we're going to have to adjust to how people are taking information. So that's the first thing, is when you're telling your story, you have to first talk about whose lives you saved because of what you're doing. Who did you set free because of how hard you're working and because you decided to take the blinders off the system that you're in? I think the second thing that we have to be willing to do, and this one is probably the hardest or the most difficult, is we have to be willing to engage people that are not the choir or people that are opposed to us. I'll give you an example. I'm not going to mention this person's name, but had the opportunity when we hosted an event in one of the second largest city in Oklahoma, in Tulsa. And while we were there, some friends of ours, they brought a friend, which is kind of funny. This person was, which this is fine, pick whatever you want to be, I don't care. But this person was an atheist, is 100% convinced that OCPA is evil and is the problem and the reason why Oklahoma can't have anything nice. And so they were there while we had someone that you've heard of, Dr. Arthur Brooks, the president of the American Enterprise Institute. So afterwards, he came up and he kind of ran up to me and he said, well, basically everything I've heard about the conservative heart is BS. And I don't believe anything that you say. And so he began to talk, and we began to talk about school choice. And this guy said all kinds of incendiary things. And I just let him talk because what I knew is that what was bothering him is that I was responding in a way that he didn't think I would ever respond. Is that I was letting him rant and rave and, call me, again, like the sellout, and that, I just forgotten where I've come from and all of that good stuff. And then finally, when we got to the end, I said, well, you want to know why I'm for free markets? And he said, well, why is that? And I said, well, because I care about the teacher who is overpaying for their medical care and the state employee health insurance. And I'm concerned about crony capitalists just like you are, especially the ones that have the really big hospitals that are on the corner, that are sitting on tons of cash, but yet keep telling people that they should get more reimbursement for Medicaid for the poor that they see, and that we shouldn't do this state employee health insurance reform at the state level because if we do, they're going to have less cash. So this guy, very hardcore guy, it's funny, people were telling me that they couldn't believe that I was having this conversation because this guy doesn't want to have anything to do with anybody that looks like they're either libertarian or conservative. And so he and I have begun to have a relationship, and I've begun to challenge him on his positions about what he thinks about how the world works and who really is the problem. So to finish, because I told you that I didn't want you to fall asleep, and I kind of have a rule that a CPA should not talk longer than 20 minutes, because if he does, then more people will hate CPAs than they do lawyers or actuaries. As you finish tonight, each one of you, there's one of the things that was mentioned, I encourage you to connect with your state-based think tank. They're just like OCPA, and they care about your work, and they care about showing the public that you're the one that is really trying to help the poor. The president talked a lot about coverage. And he said if you liked your doctor, you'd be able to keep your doctor, and that we're going to save like $2,500. And now it's come out that Aetna is withdrawing from many of the exchanges. Oklahoma, we're going to have the distinct privilege of having an extremely competitive market where on the exchanges there will essentially just be one carrier. That sounds like competition, doesn't it? And that's happening across the nation. But one of the things that we're finding is that what you guys are doing is resulting in people being able to be sure that they can have the care that they need when they need it, and that they can afford it, and that they can be cared for and not just covered. So really, all OCPA wants to say is thank you for what you're doing. I've told Keith and Jay and Megan several times that we are just bystanders who have watched you guys totally revolutionize and prove us right. You know, before 2011, we were not aware of anyone that had actually really taken seriously free markets in healthcare. And we just kept saying, because we know the history of what's gone on, and we know when you look at European countries that have switched to single-payer systems and what's happened, that surely that there was an example or a story. And what you guys are doing across the nation, I have people that are coming up for me when I speak to the American Legislative Exchange Council that has over 2,000 legislative members that are talking about direct care model legislation that's been instigated by these TPAs that want to do weird things like bundled pricing and let the employer know what the price is before they pay for it. And these doctors that are setting up these really unique practices where they're actually telling patients what the cost is before they pay for it. That's because of you. That's the only thing that's going to change what's going on in healthcare. You guys have a great opportunity to tell your story. You've had two huge kind of blows to Obamacare. One, the admission by CMS that the per costs of Medicaid are 49% higher than their estimates. Shocker, a free government program is more than the bureaucrats estimated it would cost. And then second, what is going on in the health insurance market. Soon it will be unprofitable for health insurers to be on the exchange. So absent some sort of kickbacks, which some of them are already getting from the federal government, they will not be able to participate. And that's going to allow you all to be the solution to employers that are looking for other ways to care for their patients. With that, I'd be happy to take any questions. Feel free to ask the hardest, most inciting questions you can think of. I'll turn them over to Keith, and no, really, I'll answer them. And afterwards, I'd love to talk with you if you want to find out more information about the state-based think tank that's located in the state where you are in. Thank you. Yes, sir.
How do we go about setting up a free market? I know you know about this, although you just didn't talk about it. Free market medical association organization in a state that does not have one.
So the thing that I found the most important is really kind of how the one started in Oklahoma. I would encourage you to get with Jay or Megan, and it starts just as simply with a small group. So what happened out of last year's meeting that you guys hosted here, there's at least 2 state-based think tanks that I know of. One of them is in Tennessee that connected with someone who was here at this meeting, and they are meeting at the think tank, which has an office near the Capitol in Tennessee. So that's what I would encourage you to do, to connect or find a free market leaning organization or a business that's near the Capitol where you can meet. That's what's going on in Oklahoma and a number of states. But that's how I would do that. And you would be amazed how that group grows. I mean, that's what's happened here in Oklahoma. You would be amazed by how many people are looking for something different.
Jonathan, will you talk in more detail about the first failed attempt to take the shackles off of Health Choice, and money-wise, conservatively, savings-wise, what it really does represent?
Yes. So Keith brings up a great point, which I probably mentioned earlier, is that you're going to have to persevere. So what happened, we became aware of the savings that was going on in Oklahoma County, real world, what was going on. They were saving hundreds of thousands of dollars per quarter. And so we quickly began to work with Oklahoma lawmakers to get this put in place in the 2014 legislative session. We were kind of naive, and we had this foolish notion that, everyone is concerned about the growth of taxpayer spending and higher costs for patients, and that they would love this bill. Well, to use a term that's a word picture that's very violent, the hospitals and their lobbyists strangled to death the bill in a budget committee. They came up with all sorts of fear tactics. Well, we don't know. This is an unproven process. What is this bundled pricing thing? Nobody's ever going to post their prices online. What fools these people are. And so the hospitals in 2014 worked to kill that legislation. So to give you an idea, on October 1st, they are finally going to implement the provision that was passed. Their own people internally have said that they're going to save, once fully implemented, over $200 million a year on the state's plan. Now, if you're from a large state, you're probably thinking, well, that's not much money. To give you an idea, that's 20% savings on the state's self-insured plan. And so here's how we talked about that story in 2015. Because of special interests, instead of using the savings of over $100 million on just a half fiscal year to give teachers a pay raise, instead, obscure hospitals took money in cash from Oklahoma taxpayers and teachers and used it to build bigger buildings. That's the real-world example of what happened. Keith is right. What's funny, and I think I talked a little bit about this year, we developed a very odd relationship, one that you won't see very often. We actually began working with the State Employees Union. It's like it is the only time that we've worked together on anything, before or since, and also the Teachers Union. And we began to say to them, why is it that employees in the private sector get this benefit, but you don't? Why is it that Oklahoma County employees pay no deductible if they make a decision? And then we were really devious and we said, why is it that Health Choice is not letting you know that when you choose someplace like the surgery center or some other independent facility, that you are saving the state anywhere between 3 and 10-fold? Here's what the dirty little secret that was happening. So because of the way Health Choice's deductible worked, employees paid up to the deductible, which is like most plans. But here's what would happen. If you were an employee and you happened to be aware enough to choose the surgery center, because of the way the deductible was set up and because the way you paid the first portion, you never experienced the savings if you chose a low-cost or high-quality provider. But the state did. So the state was pocketing off the backs of teachers and state employees who were unknowingly choosing independent facilities like the surgery center, all because they didn't want to tell them, because they were concerned that the big box hospitals would be concerned that they were steering. And so the purpose of our legislation was to remove any sorts of problem associated with that. If you want to talk about how to do that in your state and how to structure the self-insured plan, Keith and I and Jay, we talked about why would we do this. You're taking on the potential that government can screw something up, which it always does. And here's why. There are 183,000 covered lives in the self-insured plan in Oklahoma. That I am pretty sure that it is by far the largest plan, because United Healthcare administers the federal government's plan, I believe. They would not count as a true self-insured plan, in my opinion. So it is by far the largest plan. It is why the hospitals have fought this so hard, because once you get 183,000 people in Oklahoma realizing that they can save money by just shopping a little bit, imagine the pressure that it's now going to create on large private sector businesses that are located downtown. If the state is dumb enough to save money on their healthcare costs, then me as a large corporation should be doing the same thing too. Any other questions?
This is my brother, Brent Smith, family practice doctor here in Oklahoma.
Don't hold against Keith. Many of you may be aware, but Oklahoma is one of 7 states where Medicare is going to introduce the perverse HMO program again, where family physicians and primary care are going to be rewarded at the end of the year denying care. I'm concerned that you're talking about protecting the frail and the elderly. How would you suggest we expose the introduction of the HMO, because they're not going to tell the public what kind of evil plan this is? How would you suggest that we approach the state of Oklahoma?
So one of the things that I think that you should talk about is, and here's one of the problems with the Medicaid system. It is fundamentally flawed because you have no way to force the patient to share in the costs. There's a nominal copay, but that copay can't serve as a barrier to entry, and everyone knows that. So what happens is the private providers, they just write it off. It's just a cost of business. My personal opinion is that you've got to offer a solution at the same time you say why that proposal won't work. One of the fascinating things that's happening, you're seeing this happen on the education issue, is that social media is now driving public policy. That actually shouldn't surprise us because it's driving everything else, quite frankly. And I would encourage you, that if you're a provider and you're in the room and you're concerned about the potential for HMO and managed care to impact Medicaid, I would encourage you to be willing to publicly write an op-ed about that, and then publicly write about the pilot program that's an alternative to that in Virginia, where they are converting to direct care practices, and they have doctors who have been willing to say that they would accept a per month payment, just like they do in a practice like Jeff Davenport's here in Edmond. And that's a solution that doesn't involve a private health insurance company or a private nonprofit HMO that gets a piece of the cut from the Medicaid system. But that's how I suggest that you would do that. And then there's some incredible things you can do now on social media where you can target people and audiences. We did this to kill the Medicaid expansion. It's actually pretty cool, some of the things that you can do. The governor doesn't like us now, but that's okay. But I would encourage you to use social media and use your voice, as there's two people left that people trust in America. It's doctors and military personnel. So your voice publicly is going to be the one that's going to let people know what's the better way to care for and treat patients. And you're going to have to be willing to expose the abuse in your own system. You're going to have to be willing to expose the abuse of providers who are bilking the Medicaid system and causing it to cost so much right now. Yes, ma'am.
As far as physicians getting op-eds and written in the media, there's an organization called Doc Squads. They're set up to do just that. Even if you can't write it, they'll help you ghostwrite it. They have a very high success rate of getting you out there.
Good point. And I also should remember that your state-based think tank is constantly providing content to local newspapers. And if you're someone that has the idea and you want someone to ghostwrite it for you, I'd encourage you to do that. They kind of live for doing that. We help lawmakers write op-eds all the time. Yes.
Rather than a question, just a story. Been in the health insurance business for over 30 years. I'm on Medicare now. With the hospitals purchasing a lot of the providers or bringing them on board, I went to my first office visit under that system about 2 months ago. Normally when I've gone to the doctor's office just for a checkup or a cold or whatever, it's about $120. Maybe Medicare pays $85, $90, something like that. Well, this time I go in, I got that same charge, but on top of that, I got charged $178 for an exam room fee that the hospital charged me. And Medicare and my health insurance provider, Blue Cross and Blue Shield, paid that, no questions asked. Blew my mind.
Well, they provided you a lot of value with that exam room. So. All right, well, thank you so much for indulging me right now. Is Kurt Nelson ready? Is he ready to come to the podium? Yes. He is going to help us with some more shameless auctioning and sales, I think.